Since the spring, Canadians have been challenged in every way possible to adapt their lives to the COVID-19 pandemic. In Peel Region, our health system is being stretched to maximum capacity as we battle rising case counts and outbreaks in our schools, long-term care homes, and communities. The pandemic has impacted everyone in Peel Region. It also highlights that some in our community have greater challenges than others to access health services, reliable information, and programs. The region of Peel, the cities of Brampton and Mississauga, and the town of Caledon have not been alone in this fight. Hospitals and healthcare partners have expanded testing capacity, and community groups are helping to share COVID-19 updates and keep residents informed. Peel residents are limiting their close contacts to household members only, wearing masks, physically distancing, and working with public health for contact tracing and case management. The Peel response to the COVID-19 pandemic is a shared story. We haven't done it alone, and we cannot do it alone. Today's announcement from the Government of Canada regarding the COVID-19 Safe Voluntary Isolation Program further illustrates the need for these types of critical partnerships. We need to continue to work together to keep Peel residents safe throughout the pandemic. We will be joined by the Minister of Health, the Honourable Patty Hajdu, and Peel Region's Medical Officer of Health, Dr. Lawrence Loh, today. Before we get started, I'd like to introduce members of Parliament from Peel Region in attendance. We'll also be taking a photo after everyone is introduced. Mani Sidhu, MP for East Brampton. Sonia Sidhu, MP for Brampton South. Ruby Sahota, MP for Brampton North. Kamal Khera, MP for Brampton West. And Ramesh Sangha, MP for Brampton Centre. If I could ask all the ministers to pause and take a look at the camera for a group photo, please. Thank you. I'd now like to ask the Honourable Patty Hajdu to share with us her government's news.
Thank you very much, Samantha, and thank you, Dr. Loh and the whole team at Peel Public Health for your incredibly hard work. You know, I was reflecting at how much we thank our frontline healthcare workers and how much that thanks is deserved, but it's not often that we get to really speak to the specific work that public health is doing. And I, having spent 9 years in public health, have a full and deep appreciation for how busy all of you are and how your teams are working so hard to protect the region of Peel and the people that live there. And I just want to profoundly thank you. And I know my colleagues, hello colleagues from the House of Commons, all of you are also incredibly grateful for your professionalism and for your dedication during what I would call an unprecedented health crisis of our lifetime. I also think, Samantha, your comments for collective action are incredibly timely because, of course, crisis sometimes drives us apart. But what we really need to beat COVID-19 and to protect all of the health of our citizens is everyone working together and everyone thinking beyond their little box of what's good for them. And a real call to collective action is what I heard in your remarks. Because, in fact, what we know and what is proving to be true around the world is that countries that work together, communities that work together can get out of this faster, can protect and save lives. That's what it comes down to. It's about saving lives at the end of the day. And we talk about cases and numbers a lot, but we're talking about people, families that are scared, that are often in the most vulnerable circumstances of their lives. And I just want to thank you again for reminding us all that the only way through this is actually thinking about everybody else as we go through this journey together. So I had the opportunity to meet with Dr. Loh and Samantha and others. It feels like a lifetime ago, but in COVID time, really only about a month ago, maybe a bit longer. And we were talking about Peel's response to then the increasing numbers that were quite alarming for the region, and the work that Peel Public Health was doing, and the work that the federal government has been doing to provide an additional layer of health supports to regions that are particularly hard hit. early on in the spring, our government decided to create something called the Rapid Response Program. And as Dr. Lowe and I and his team, including other officials from the community, talked about the response, of course, we talked about the ways that the federal government could indeed assist, including things like additional contact tracers and other tangible inputs, if you will. But we also talked about the unique quality of the Peel region and the fact that Peel represents a home for many, many racialized and people living in poverty who are experiencing low socioeconomic realities, which leads to, as we would all know, sometimes very crowded housing conditions. And I will say that I was really happy to let Dr. Lowe know that another program that we had established early on was available to the Peel region. And under the Safe Voluntary Isolation Sites program, which is a long name for saying that the federal government early on knew this might be a challenge and stepped up to fund these isolation sites for communities exactly like Peel that have very dense housing situations, sometimes large multi-generational families that live in one home, or sometimes situations where people are sharing rooms or in rooming houses. There are a whole bunch of scenarios where people are really struggling. Rent is high, the cost of living creates these really crowded situations. And of course, one thing we know about COVID is that it's an opportunistic virus that sees an opportunity like that, if you can think of the virus seeing an opportunity to spread more easily when people are packed in like that. People are sharing bathrooms, they're sharing kitchens, they may not even have a bedroom to themselves. And of course, that creates additional spread. And every person that contracts COVID, of course, is at risk of, first of all, very, very adverse outcomes for themselves, but certainly passing it on to their colleagues, to their loved ones, to their family members, or even just to acquaintances. So under the Safe Voluntary Isolation Sites program, the idea is that the federal government will work directly with local communities to provide funding to operate voluntary isolation sites. And what does this mean? This means if someone's diagnosed with COVID or at risk of contracting COVID, the municipality will have a location where that person can isolate safely to protect the community and thereby break the transmission of COVID-19. This is what we're all working towards. We're working towards less number of people that are sick and obviously saving the lives of folks that get COVID-19 and are seriously ill. So today we're providing $6.5 million to establish a safe voluntary isolation site in Peel region. Again, I think it's at a perfect time where you start to see cases increasing and, working so hard under a number of restrictions that I think are necessary right now to slow down the spread. But this is an additional tool in your fight to actually reduce the spread of COVID-19. The site will consist of 40 rooms and it can be expanded to 80 rooms if in fact you find it useful and it's something that residents also find useful. The site will provide a safe place to self-isolate, and the decision to stay is of course completely voluntary. And I know that public health has years of experience working with vulnerable people and talking about how best to support them in very difficult situations. So I want to thank Dr. Lowe and the entire team at Peel Region Public Health, because in fact, what you're demonstrating is innovative thinking, the desire to step outside the box and try something new, but also this willingness to partner and to really think about solutions that work with community members, encourage community members to do the right thing, support them to do the right thing. We talk a lot about people not following the rules, but there are a lot of people that just simply can't. And something like this is actually going to help people, first of all, protect themselves, and then secondly, protect their family and their community, which is, I think, at the heart of what every person wants to do in Canada. So I'm very, very thrilled that you're moving forward on this. And of course, we'll be there with you for everything else that you might need in between. Thank you very much.
Thank you, Minister Hajdu. And for the federal government's active participation in the COVID-19 response, especially for those communities most in need. I'd now like to invite the Region of Peel's Medical Officer of Health, Dr. Lawrence Lowe, to share his remarks with us.
Hi, thank you very much, Samantha, and thank you, Minister Hajdu, MPs, and everyone who has joined us virtually. I'm honored to be here to announce that we will be moving forward with this safe voluntary isolation site program here in the region of Peel with the grant of $6.5 million over 16 months that will be received from our federal counterparts. We are excited to receive this funding and to be able to expand our capacity to support more Peel residents during such a difficult and unprecedented time. This funding will enable the region to accommodate more residents who are challenged to self-isolate at home due to health, safety, and financial constraints. We know that self-isolation is a key step to stopping the chain of COVID-19 transmission because the virus cannot spread when we stay apart. Starting on December 1st, 2020, the funding will allow the program capacity to grow to 80 units as needed. The existing program has been operating at a capacity of 25 people. Peel Public Health is working in partnership with the Region of Peel Human Services, given their experience in establishing and operationalizing an existing voluntary self-isolation site for all residents who qualify and need support. It is evident that disparities exist within our community and that these disparities affect our ability to do all we can to reduce the level of risk and keep our residents safe. It's not a surprise that many of the communities in Peel many individuals in different communities in Peel have an increased risk of exposure and severity of outcomes in this pandemic. When you can't work from home, when you live with many other people and you cannot safely self-isolate in your own household, when you are sick or exposed to the virus and must choose between your paycheck and doing the right thing, you are at greater risk. I recognize that some people are not in situations where self-isolation is feasible, and the expansion of our program will allow more people to safely and temporarily self-isolate in order to prevent the spread of COVID-19 in our community. This partnership will allow us to respond immediately, making safe spaces available for Peel residents who may require this support. The program also leverages medical staff as in-kind support for COVID-19 testing and support to those self-isolating. Building upon the current program, clients can be referred to the program from area hospitals and from public health. If a client identifies that they cannot self-isolate due to their current living conditions, they will be referred to the program. The Safe Voluntary Isolation Sites program will be jointly managed by the Region of Peel Public Health and Human Services with dedicated staff funded by the Public Health Agency of Canada for the duration of the project. To accommodate additional individuals in existing voluntary self-isolation sites, Public Health and Human Services will expand eligibility requirements and secure more units as required. We continue to look at other ways to stop the spread of this disease and protect the residents of Peel. People in Peel have gone through quite a bit in 2020, and through this response have shown tremendous resiliency and dedication. We know that the picture may get worse before it gets better, and we need to continue to focus on what we can do to stop spread and break the chains of transmission. The Safe Voluntary Isolation Sites program is one more step in stopping the spread of COVID-19 in our community. Again, I'd like to thank our MPs, Minister Hajdu, you're a friend of public health, and our teams at the Public Health Agency of Canada and Peel Health who have brought this together and who will continue to move this important program forward to help protect our community and stop spread of COVID-19. Thank you.
Thank you, Dr. Lowe, and for your unwavering dedication to serving the people in Peel during this truly unprecedented time. So I believe we have media on the line, and we will now take questions on the phones.
Welcome, everyone. We are starting our question and answer period. Please limit yourself to one question and a follow-up, and please identify yourself along with your media outlet when called upon. First question is for David Atkin. Please go ahead.
Okay, I think I'm unmuted. Can you hear me, gang?
Yes, we can.
Thank you. Hello, everybody from all the Peel MPs. Good to see you. But my question is for Minister Hajdu. Minister Hajdu, just a few moments ago at Queen's Park, your provincial counterpart there, Minister Elliott, told reporters that Ontario does not expect to receive vaccines in early 2021. And she says because the federal government is letting Ontario down. Will Ontario be getting vaccines in early 2021, and will other provinces get vaccines in early 2021?
Thank you very much, David. And right now, as we speak, there is a tech briefing on the vaccination deployment plan that the Government of Canada has been working on since October, where details will be are being shared right now with journalists on the plan. Certainly, that is our goal, to have vaccines arrive in Canada early 2021, and the Minister of Health knows that. Certainly, we have contracts with 7 leading vaccine manufacturers. In fact, the best portfolio in the world, including the most per capita doses in the world. And this is good news for Canadians. This means that we have a diverse portfolio of a variety of different kinds of vaccines, and we are working diligently with all 3 of the leading manufacturers that have submitted for regulatory approval. These are rolling approvals, which means that we are assessing data as the manufacturers provide them. And of course, everybody is very excited about a vaccine arriving, but I know my public health colleagues would want me to remind people that although the vaccine will be a critically important tool to ending COVID-19, that we need to continue during this time to practice the public health measures that we've all learned, which is to stay physically apart, to wash our hands, to make sure we're wearing our masks, that we reduce our mobility, that we stay home as much as possible, and that we protect ourselves by downloading COVID Alert.
And I appreciate that a technical briefing, of course, was scheduled by your department at the same time that this press conference was scheduled. A bit odd there. We have had reporters who listened to Dr. New at the technical briefing. He provided no information about when the vaccine would be available, other than to say when vaccines are available, Canada will be ready. So again, I'm just wondering why Minister Elliott would have had such contradictory information to suggest that, you know, a big province like Ontario is not getting a vaccine. Can you give us some more definitive answer to that Canada will have vaccines in early 2021?
Well, I can't speak to where Minister Elliott is getting these ideas that Ontario will not have access to a vaccine in early 2021. In fact, that's the target that we're shooting for. Of course, there are a number of steps that we need to proceed through in a way that's safe for all Canadians. And one of those is the regulatory review. And let me just remind you, David, and all Canadians that Canada will do its utmost diligence to review the data of any vaccine to make sure that it is safe for use in Canada. That is a critical component of Health Canada's role as a regulator. We know that these are new vaccines, and I think Canadians expect us to make sure that we are doing our full due diligence to understand the data and ensure the safety and efficacy of these vaccines.
Thank you. Our next question is from Laura Stone. Please go ahead. Laura Stone, please go ahead with your question.
Moderator, it's David Aiken. You may have unmuted me instead of Laura.
No, Laura is. Laura, please go ahead with your question. Okay, we're going to move on to Steve Cornwell. Please identify yourself and go ahead with your question. Please unmute yourself. Steve, are you able to go ahead with your question, please? Okay, we're going to go back to Laura. Laura, please go ahead with your question. We will take a question from Nitin Chopra. Please go ahead.
Hello.
Hello, go ahead with your question, please.
Good afternoon to all. Hope my audio is clear. Good afternoon, Minister. And good afternoon to all the MPs of Brampton. And thanks for the funding which is given to Peel for the reduction of COVID effect here. Minister, my question is like, since Brampton was hardly hit into the COVID and massive number of cases came out from the Brampton, where Brampton was criticized also for this many times. But Mayor Brown was very vocal and gave a reason many of the time that why the cases were high here, because most of the essential workers work out of the Brampton. Now the question is like, why Brampton does not have a isolation center of its own? As we heard that isolation center might be in Mississauga, it's very hard for Brantonians to move to 40 kilometers away to Mississauga to get checked or for the isolation. Why that kind of discrimination with the Brampton? Why Brampton does not have its own isolation center, or if it will have in the future? Thank you.
Thank you so much for the question. And I'll just say this, we worked really closely with Peel Public Health to make sure that they had the money needed to cover all aspects of the isolation center, including transportation for people that may not be able to get to and from the isolation center. We know that there are a number of barriers for people. This is exactly the nature behind an isolation center, is that a number of people that are at risk of becoming infected or who are infected with COVID-19 don't have the same resources that other folks do. And that is a deeply part of the consideration of the Peel Public Health team. And I think it would be best if they would speak about the specifics, but just to say that the funding covers all of those kinds of costs.
And so thank you, Minister Heidi, for starting the answer, and Nitin, I can clarify the additional answer. As a matter of expediency, the focus of the program is on expanding an existing site for voluntary isolation, but certainly in consultation with the community and in responding to the data that we have, additional capacity as well as sites are being explored and will be brought on as appropriate and determined through our community consultations in the days and weeks to come. Thank you.
Nitin, do you have a follow-up question?
Yes, I have a follow-up. We also got some tips that like in Mississauga, the isolation center will be in the homeless shelter. So where the homeless will go in that scenario?
So Nitin, I can be very clear. The existing program was a hotel facility that was used for recovery for individuals who tested positive within the shelter system. But the aim is to expand this program to allow for broader voluntary isolation for all residents in the community to make sure that those who are unable to safely self-isolate will be taken care of. And so that would include individuals who are underhoused or experiencing homelessness, but certainly would include anybody who is having difficulty self-isolating in their existing living conditions. Thank you.
Thank you. And the next question is from Laura Stone. Please go ahead. We are going to take a question from Amik Singh. Please unmute yourself and go ahead.
Hi there. Good morning, good afternoon, everyone. The question I have is for everyone. I know that we've learned here in Peel Region after the start of the holiday season, some implementation. Hi there, can you guys hear me? Okay, perfect. Hi there, everyone. My question is for everyone is, I know going up to the holiday season, we saw a lot of changes happen in the public health measures that were implemented and the information dissemination that was needed to make sure the implementation was done in the right manner. Given the hindsights learned from Diwali and also Thanksgiving, we're approaching Christmas season and the festival season at large. With the new lockdown measures in place, the broad general consensus is that there's still confusion about how to implement these measures in small businesses, in different parts of the region, and the way the public at large is engaging with public health information. So are there any plans from the region's perspective to implement, help implement these measures in places of worship, in small businesses, your mom and pop shops here, and the ethnic businesses that live in Peel region? What is the strategy the region of Peel is taking to make sure that these measures are implemented as quickly as possible? Well, that's my question.
So thanks, Meek. I think that would be for me. Can you clarify by measures, you mean the closures that have been put forward by the gray lockdown?
That's right. That's right.
Yeah.
Dr. Wolf, yes.
So thanks. So the measures, as you understand, or as you know, came into effect on Monday at midnight under the new provincial response framework. The expectation is that the closures or the venues that are meant to be closed will close. Certainly, we will work with any venues that do remain open to ensure that they're aware of their responsibility under the regulation to be closed during this time as the community has moved into this phase. And in specific around broader community engagement, if you're speaking to specific cultural and ethnic communities in our region, pretty much since the last 2 months, pretty much since school reopened, we have started having increasing conversations with a number of cultural and faith and community leaders to really understand how we can make sure that broader messaging is getting through both around the measures and the restrictions, but also the precautions that residents can be taking to protect themselves. And so that is one important piece of what we continue to do, in addition to the actual enforcement aspects of the recent closures and the lockdown measures that were brought into effect. I would also add that in addition to that, the region of Peel Public Health is looking at additional measures in respect of advancing better worker protections, workplace safety, paid sick days, et cetera. All very important measures that are needed for our essential workforce, which continues to work even throughout this gray lockdown period, to ensure that transmission in those settings is also being addressed with effective measures. So all of this is being developed into an updated pandemic plan, which I hope to present to our regional council in the weeks to come. Thank you very much for the question.
Follow-up question?
Follow up. I know the region and Health Canada and all levels of government are working as best they can to make sure that the dignity of care and dignity of isolation in essential working communities such as Peel region is maintained, especially for those the most vulnerable, the precariously housed, the ones that are recently just come into Canada. Peel region is a hub for immigration, but there is a sense of fear, and we heard that fear kind of come out in the last question that was asked in terms of what the measures are. I know the region has an existing site, as you've mentioned before, and we're expanding that to maintain the opportunity for those that need to get the isolation period done in a safe site, so they're not spreading COVID within their household. My question is, in terms of the program and the fear that's out there, how can that be addressed by Peel region and also Health Canada in terms of who is allowed in the site and what are the measures? Is there some clarity in terms of what is actually being implemented in these sites? Could that be broadly discussed with the community at large?
Sorry, I was stuck on mute. Apologize. So yeah, thanks so much for the question, Amik. At this point in time, the eligibility for this program would be an individual who shares a home with one or more individuals, is awaiting a COVID-19 test result, or has tested positive for COVID-19, and lacks the ability to safely isolate at home away from cohabitants for the recovery period, or requires a place outside of their home or shelter to self-isolate for personal safety considerations, or shares a household with or self-identifies as an individual who's at higher risk of severe COVID-19 disease, hence would require more close monitoring. And that eligibility would be determined in the course of their receiving clinical care or case and contact management. So hospitals and public health units, in the course of working with individuals who are awaiting test results and are testing positive and identify as meeting any of those criteria, would be referred for consideration of entry into the program.
Thank you. Our next question is from Laura Stone. Laura, please go ahead.
Hi, everyone. Can you hear me? Oh, great. Thank you. Third time's a charm. Okay, thank you so much. Minister Hajdu, I wanted to ask you again about the comments in Ontario, and just more broadly, we had the Ontario Health Minister come out and announce that the province would be getting 2.4 million doses of Pfizer and Moderna in the first 3 months of 2021. Today, she said the comments from the Prime Minister recently about a lack of domestic manufacturing capacity were very concerning, and she cast doubt on those numbers. So can you just explain what is going on between the communications between your government and Ontario? And can you confirm the doses that Minister Elliott has said that this province would be receiving?
Well, thank you very much. I think, first of all, the comments broadly reflect the enthusiasm and excitement that all provinces and territories and all leaders of health portfolios are feeling around some relief in the form of vaccines that will arrive in 2021. And I will say that we expect to get 6 million doses of at least 2 of the 3 vaccines in Q1 of 2021. So that's part one of the answer. The minister is incorrect. And, the Prime Minister was speaking about domestic manufacturing, and he's right. There has not been an investment in domestic biopharmaceutical manufacturing in Canada for a number of decades. And in fact, a number of high profile pharmaceutical manufacturers left the country during actually the Conservative years. And, I can't speak to that except to say that because we knew we were in a vulnerable place from the ability to produce our own vaccines, given the limited landscape for pharmaceutical manufacturing, we secured again an amazing portfolio of vaccines from a variety of different pharmaceutical manufacturers from across the world. In fact, 7 leading candidates, 3 of them which are in regulatory reviews already. In fact, we're the only country in the world to have the 3 top leading candidates under regulatory review right now. So we're well positioned to be able to deliver vaccines in early 2021. Again, we are working closely with the manufacturers to understand the safety data, the manufacturing data. All of that is being reviewed because, of course, we know that Canadians expect us to ascertain that these vaccines that will be approved are safe for use.
And just to follow up, you said in your answer the minister was incorrect. Can you just expand on what she was incorrect on? And just to clarify, this isolation center, it's going to be put up in Mississauga, correct? And can you explain why Brampton wasn't chosen, especially as a result of their very high positivity rate and the number of cases that we're seeing in that city?
I'll respond on the Minister Elliott's assertion that we are not positioned to receive vaccines in early 2021. I would just say that she's incorrect because, in fact, we have contracts with pharmaceutical companies with delivery schedules, and as you know, and as has been stated a number of times, we have contractual obligations to receive up to 6 million doses from Pfizer and Moderna, in particular, in Q1, and that is good news for Canadians.
And so, Laura, I know you were having technical difficulties earlier, but I can repeat my earlier answer as to why Mississauga. As a matter of expediency, we are expanding an existing site that has been used for isolation and recovery, and we are continuing consultations with the community and in reviewing our data to determine where additional sites may be placed, and we are hoping to be able to place those there in days and weeks to come. And also to really highlight as well, Mr. Hajdu mentioned this early on in her remarks as well, transportation to the site is covered by this funding from the federal government. So the issue of if then individuals identified anywhere within the region of Peel but needs, they could be in North Caledon for all we know, they will be supported to make sure that they get to the isolation site should they meet the criteria and wish to avail themselves of the program. Thanks for the question.
Next question is from Denise Paglinawan. Please go ahead. Sorry, Denise is not there. Please, we'll go to Julie Gordon. Please go ahead. We will try Steve Cornwell. Please go ahead.
Hi, Steve Cornwell from Mississauga News. Can you hear me?
Yes, we can.
Wonderful. Just a question about the timeline of this. My understanding, this is a question for Minister Hajdu. My understanding for the timeline was that Peel Health had applied for this on October 5th. And if it does open December 1st, it's obviously close to 2 months since the original application. So I'm just curious about why this did take such a long period of time, kind of given it was an expansion of an existing project that Peel Health was running.
Thank you for the question. I just want to thank Peel Regional Health for working actually so quickly to get the details to Health Canada to make sure that we could fund the full comprehensive package. I will just say it's 100% funding as well. There is no provincial partnership. This is all federal money directly to local public health, and it does scope in things like transportation. Obviously, at the federal level, we work really closely with the applicants to make sure we understand exactly how they're going to deliver the program and support them actually in that planning. There are a number of other isolation sites now in Canada, and again, drawing on the theme of working together, we've managed to actually connect people who are running these isolation sites because, of course, as you can well imagine, there are challenges involved in housing people, especially people that potentially are ill or may get even more ill. And so I think all things considered, this is a pretty rapid response, and I'm thrilled with the collaboration with Peel Public Health.
Follow-up question?
And just maybe a clarification on the existing program for Dr. Loh. Are you talking about the program that was in place for folks who had gotten or had COVID in the shelter system? Is that the one that was operating at 20 people, or is this another program for like a voluntary isolation center?
Yes, thanks so much, Steve, for the question. Just to add to Mr. Hajdu's piece as well, as you know, the timeline that you identified from October 5th till now also saw the arrival of the second wave in Peel. So a lot of our discussions, unfortunately, were interrupted by our need to respond to the immediate second wave. And so that may have slowed things down a bit, but certainly I think a 2-month turnaround and partnership, I think that's pretty significant, at least in terms of how we managed to get that out where we did. I wanted to add, so yes, you're absolutely right. This is an expansion of the existing program, and that's why it's located where it is in Mississauga right now. It's about expediency and trying to get the program online as quickly as possible, in keeping with the theme around speed. And so certainly it is an expansion of that program and the eligibility for individuals who may qualify to be part of that voluntary isolation program. So thanks for the question.
Next question will come from Denise Paglinawan. Please go ahead.
Yes, can you hear me? Okay, perfect. My question is for Dr. Loh. A couple weeks ago, reports say that hospitals in Brampton are in capacity. I'm wondering what the situation is right now for hospitals there.
So thanks very much for the question, Denise. As I understand it from our hospital partners, not only in Brampton, but now also at Trillium Health Partners in Mississauga, they have both activated surge capacity plans at this point in time. That has included things like canceling elective surgeries and treatments, and also starting to use non-traditional spaces within the hospital property to make sure that patients are treated. A lot of this is driven by a surge of COVID positive patients that is impacting operations, both in terms terms of the isolation and infection prevention and control needs, which is taking up a lot more hospital beds and space than would traditionally be used for other care, as well as the ongoing high volumes of care that both of these, I mean, these are probably some of the busiest hospitals in the country, that the ongoing high volume of care that both hospital systems in our region continue to provide. And it is worth noting, I believe at a recent Ontario Health briefing, it was identified that 2 of the 3 most impacted hospital systems in the province of Ontario at this point in time are here in Peel region, both Trillium as well as William Osler.
Follow-up question?
Yes, and again for Dr. Lowe or maybe Minister Hadu. So a lot of the essential workers or people in Brampton, they say that they can't self-isolate because they have to work and no one's going to be providing income for their families. What are you doing to help them with that?
So I could start. Denise, thanks for the question. I've highlighted this in many of my public representations over the last few weeks, that a number of our essential workers are also precariously employed. They're working on temporary contracts, and they need to receive supports of some variety to ensure that they do the right thing when they're sick or exposed, and self-isolate rather than having to work just because they need to make sure that they keep a roof over the head or keep their job, or out of fear of losing their job. So to the extent that supports such as paid sick leave, income supports, rent, eviction protections, these are all critical measures that have been used with some success in other jurisdictions. And at least from my view in a medical perspective, would essentially help change some of the incentives to ensure that people are incentivized to do the right thing and stay home if they're sick or need to be isolating.
And I'll just add to that, after the conclusion of the very successful CERB program, we knew that people would still become sick with COVID-19, would still need to take time from work, perhaps to even take care of people who are sick with COVID-19. And that's why we made expansive temporary changes to the employment insurance program. So now you only need 120 insured hours to qualify for benefits. And that allows for the new and enhanced employment insurance at a higher level as well, that will allow for people to be covered financially when they take time off work. Obviously, we've had this in mind from the very beginning, which was the basis of the CERB at the beginning. And as we were coming out of the first wave, knew that we would likely see ongoing infections and people still needed financial supports to be able to take that time. So I would just encourage the media to remind people that there is EI coverage as well for any worker that has to take time away from work as a result of COVID, not just necessarily for themselves, but also as a caregiver.
Ladies and gentlemen, this will be our final question. It's coming from Julie Gordon. Please go ahead.
Thank you. Can you hear me this time? Great. That's wonderful. Actually, Denise asked most of my question, but I'll just follow up on that a little bit by asking you, Minister Hadu, what about extending those sickness benefits past the 2 weeks? I mean, if you have a situation where that merits more time, is there room for more work to be done by the federal government in terms of making sure that people who are vulnerable are able to isolate and take care of children and do all these things?
Certainly, there's always room to improve. I'm not aware of the particulars of the ins and outs of the program as we would be seeing it evolve. But I'll just say this: that we have our mind on making sure that we will have every protection for Canadians for as long as it takes to get through this. I know that the Minister of Finance is regularly reviewing the whole suite of programs that we provide, including the wage subsidies for businesses and the CEBA loans and the variety of other economic supports that are keeping people employed in industries that are really hard hit as a result of slowdowns and restrictions. And this is top of mind for us. How do we help Canadians get through this time financially secure as possible? Help businesses, especially small ones, survive, so that when the world comes out of COVID-19, Canada's well positioned to restore our economy and help people transition back into full employment.
Julie, do you have a follow-up question?
Oh yeah, maybe to Dr. Lowe. I mean, what more can Canada do?
Yeah, thanks so much for the question, Julie. I mean, first of all, I think all levels of government have really been trying to work together in making sure that this gets addressed. And so I've really been grateful for the support and collaboration of our local, provincial, and federal partners here in the region of Peel, which is a particularly hard hit region, as we know, but not unsurprising. I think the reality is that this is a disease that's spread from person to person, and urban areas have lots of people, and so that really reflects a lot of the patterns that we've seen even here in the province of Ontario as well as elsewhere in the world. I think what I've made very clear is that the current closures and curtailments over the next 28 days are designed to try to bring our case counts quickly down. But we do need to address the issue of disparities, which continue to drive transmission in our community. Many of these disparities are also reflected in other health outcomes. For a long time, we've known that the disparities drive, challenges with mental health outcomes, with chronic disease outcomes, et cetera. It's really taken this infectious disease to maybe, act as a nice reminder to all of us that all of us are ultimately connected, and that ultimately we have to take care of everyone, especially the most vulnerable and the most precarious in our society, to ensure that we get ahead of this disease. So everything that I mentioned in terms of supports for essential workers, supports for households, those are all going to be critical components going forward. And this voluntary isolation center and any potential expansion of the program, as we will encounter through community consultation, is one piece of a giant puzzle that we are continuing to put together. So thanks very much for the question.
And I might just add that in Ontario, out of every dollar spent on COVID response, 98 cents has come from the federal government. That we created a $19 billion transfer to provinces and territories that we delivered so that they could expand things like testing, contact tracing, and support people through better data. That we also contributed $2 billion to the safe restart of schools, $740 million for long-term care across the country, and more. And so I will just say the federal government has been there every step of the way for provinces, territories, but more fundamentally for Canadians. Because at the end of the day, even though healthcare is fully within the jurisdiction of provinces and territories, the federal government plays an important role in crises and times like this to be able to support Canadians to stay as healthy as possible, protect their families, and protect their own financial circumstances.
Thank you for your questions, everyone. Samantha, back to you.
Thank you very much to the Government of Canada and Minister Hajdu for sharing this important announcement today with Peel. Once again, Peel residents can access the COVID-19 Safe Voluntary Isolation Site Program through referral by the hospital or public health. Self-isolation can be a difficult thing to do, but it's very important to cut the chain of transmission at its source. We're thankful for the support and opportunity to further expand capacity for Peel residents to self-isolate as we continue to navigate COVID-19 together as a community. Thank you.